The immune system is your body's natural defense against foreign and potentially harmful substances. Immune senescence refers to the deterioration of the body's immune system as a result of aging. As we age, our immune system deteriorates, and this leaves us increasingly susceptible to health threats like cancer, autoimmunity, infections, and chronic inflammation. This process is called immune senescence. Scientists are studying various methods for countering the immune senescence, including young stem cell mobilized plasma transfusions. Research suggests old blood might contain pro-aging factors, whose concentrations are diluted by young blood transfusions, potentially causing rejuvenating effects. In addition, several natural interventions, including the herb Senescence, reishi, and ZINC, might slow or potentially reverse the course of immune senescence. Aging accelerates the immune decline, with decreased number of naive T cells, or cells that can easily be activated to recognize and respond to diseases like the flu and cancer, and increased numbers of senescent memory T cells that have lost their ability to divide and to function properly and instead release pro-inflammatory molecules. Decreased natural killer cell activity, which is linked to increased illness and death from infections, atherosclerosis, and a diminished response to the flu vaccine. And cytomegalovirus infection, which can be associated with immune senescence, cardiovascular disease, frailty, and mortality. One or more components of young blood might be able to reverse some aspects of immune aging. Another emerging theory is that there might be factors in old blood that trigger the immune system aging. In a lab study, treatment of aged immune cells with granulocyte colony stimulating factor, GCSF, it resulted in the improvement in the function and the mobility, and increase in the number of the immune cells. The over-the-counter heartburn medication, cimetidine, possesses immune-modulating and anti-cancer properties. Intermittent cimetidine cycles could be considered in an immune senescent regime. Calorie restriction in animals has been shown to prolong lifespan and to delay aging, and to confer a more youthful T-cell profile. In a 2014 review, greater adherence to a Mediterranean diet was associated with significantly reduced levels of important markers of inflammation. Exercise and stress management can also improve the immune function. A formula with the herb Senescence as the primary ingredient conferred multiple benefits in a clinical trial, including increased helper T cells, improved relative proportions of types of T cells, and greater NK cell activity. A rigorous review of controlled clinical trials found cancer patients who used reishi along with chemotherapy and radiation showed an increased percentage of several subsets of T cells, and they might have slightly increased NK cell activity. In a randomized controlled trial in individuals with metabolic syndrome, Puer-T significantly decreased the levels of inflammatory markers, while also increasing the levels of anti-inflammatory molecules. Enzymatically modified rice bran has been shown to enhance the number and the function of immune cells, particularly the NK cells. In a placebo-controlled study in healthy older volunteers, a daily intake of zinc for 1 year resulted in a 67% reduction in the incidence of infections, and it reduced the levels of an inflammatory cytokine. As we age, we become increasingly susceptible to health threats like cancer, autoimmunity, and infections. One important cause of this vulnerability is immune senescence, the insidious deterioration of the immune system function that occurs during aging. Over time, our ability to fend off bacteria and viruses diminishes, our response to vaccinations weaken, and critical anti-cancer defenders called natural killer cells become increasingly impaired. At the same time, smouldering, persistent inflammation runs rampant in the aging body. Our immune systems diversity declines as we age. This reduces our defense against novel pathogens. These changes are due in part to the immune senescence. Scientists are studying the various methods for counteracting the detrimental effects of aging on the immune function. One approach has garnered considerable interest, and it's young stem cells mobilized plasma transfusions. Early studies suggest that joining the circulatory system of young and old mice reversed some age-related changes in the older mice, leading to the assumption that young blood contained anti-aging factors responsible for these benefits. Newer research suggests old blood might contain pro-aging factors whose concentrations are diluted by the young blood transfusions. Currently, studies are underway to determine if the young blood transfusions or the elimination of the pro-aging factors in the old blood can bolster the function of the aging human immune system and promote longevity. One trailblazing physician who specializes in stem cell transplantation and research has explored the potential of using granulocyte colony stimulating factor to activate immune stem cells and to combat immune senescence. Another intriguing intervention for bolstering immune function in advancing age is the common over-the-counter heartburn medicine cimetidine. This drug has overlooked immune-enhancing properties, and it might protect against a number of cancers. Also, results from animal studies indicate cimetidine enhances the immune system's response to antiviral vaccines, and it may be used on a short-term basis to bolster the immune defenses. Few people are aware that a common virus can also contribute to immune senescence. Cytomegalovirus lingers in a latent state in a significant portion of the population. This means you could harbour the virus and not even know it. Latent cytomegalovirus infection might shift the balance of the immune cells towards memory T cells specialized for the cytomegalovirus, and away from the naive immune cells that combat novel pathogens. Also, cytomegalovirus infection has been associated with numerous diseases, including deadly glioblastoma brain cancer. Fortunately, interventions exist that might help to offset the immune compromise caused by the latent cytomegalovirus infection. Enzymatically modified rice bran, for example, can help to reduce cytomegalovirus burden and mitigate the consequences of the latent infection. In addition, a variety of natural interventions might slow or potentially reverse the course of immune senescence. Evidence from clinical and preclinical studies indicate that natural products such as reishi mushroom, sustanche, and pu'er tea possess potent immune modulating properties that can be harnessed to deter immune senescence. Lifestyle improvements, including regular exercise, stress management, adequate sleep, and an anti-inflammatory eating pattern, can also suppress chronic inflammation and support the immune system. Though requiring more dedication, calorie restriction has been shown to improve immune cell function and to promote longevity. The immune system includes two closely related components: innate immunity and adaptive immunity. Innate immunity is the body's first response to foreign and potentially harmful substances. It's ready to mobilize rapidly and can non-specifically attack particles that trigger an immune response. Important components of the innate immune system include physical and chemical barriers like the skin and its secretions, the lining of the gastrointestinal and the respiratory tract, and the stomach acid, phagocytic white blood cells, immune cells like neutrophils, macrophages, monocytes, and dendritic cells that engulf and destroy invaders, and they activate the adaptive immune system. Natural killer cells, or NK cells, specialized immune cells that act rapidly to destroy abnormal cells, especially tumor cells and virus-infected cells. The acute phase proteins that are involved in both innate and adaptive immunity. Some acute phase proteins include C-reactive protein and fibrinogen, and these are useful clinical markers of inflammation. If the innate defense system doesn't eliminate a threat, the next level of defense is the adaptive immune system, and this responds specifically to individual antigens. The adaptive immune system includes antibody-mediated immunity and cell-mediated immunity. In antibody-mediated immunity, immune cells known as B cells produce and secrete antibodies into the blood and other tissues. Antibodies recognize and bind to specific antigens that occur on the surface of bacteria, viruses, fungi, or allergens, or, in the case of autoimmune conditions, self cells, in order to eliminate them or tag them for destruction by other immune cells. Cell-mediated immunity relies on T cells, and it can be active against infected cells as well as phagocytic cells that have already engulfed harmful microorganisms. The thymus gland, located in the chest behind the breastbone, is responsible for the production of mature T cells. Age-related atrophy of the thymus gland plays a major role in immune senescence. Three important T cell types that participate in cell-mediated immunity are helper T cells, cytotoxic T cells, and regulatory T cells. Helper T cells augment the function of other immune cells. They promote antibody production and B cells, and they help other immune cells to recognize and to kill microbes and infected cells. Like the natural killer cells, cytotoxic T cells directly attack and destroy foreign, infected, and abnormal cells, including cancerous and non-self cells. Regulatory T cells generally control or terminate an immune response to a perceived invader, minimizing tissue damage and helping to protect against conditions in which the immune system reacts excessively, such as autoimmune disease and allergies. Emerging research suggests regulatory T cells might play a role in immune senescence. Some types of regulatory T cells appear to accumulate with age, and they might weaken the immune response to pathogens or malignant cells. At the same time, it appears the number of other types of regulatory T cells remain the same or even decline. Furthermore, the function of regulatory T cells might change with age. Thus, a balanced and properly functioning array of regulatory T cells appears to be necessary to avoid smoldering chronic inflammation, while maintaining immune competence and protection against infection and cancer. Overall, the impact of regulatory T cells in the context of immune senescence cannot be stated categorically, and it may vary among individuals. For example, a person with a history of autoimmune disease could potentially benefit from increased regulatory T cell numbers or activity, while someone prone to infections or cancer but without a history of autoimmune disease might benefit from decreased regulatory T cell activity. The approximately 30 trillion bacteria that inhabit our bodies are collectively referred to as the microbiota. Most of these bacteria colonize the gastrointestinal tract, where nearly 70% of the immune system resides. Disruption in the balance of the intestinal microbiota can increase inflammation, lead to infection, and contribute to disease development. Antibiotics and other drugs, toxins, diet, and harmful microbes can disrupt the proper balance of the gut microbiota. Changes in the populations of gut microbes can also be associated with aging. Compared with the diet of people living in less developed countries, the typical Western diet tends to be lower in fiber and higher in fat and refined carbohydrates. These dietary differences influence the composition and the function of the gut microbes, which can in turn modify the immune function. The immune-enhancing and life-prolonging effects of calorie restriction may be partially explained by the alterations in the gut microbiota. Animal and clinical studies have shown that calorie restriction may increase beneficial microorganisms in the gut and decrease detrimental ones. Calorie restriction may also reduce the amount of immunity-provoking compounds, like antigens, taken up by the gut, reducing the stress on the immune system. Clinical trials have shown probiotics can enhance immune function in the elderly, potentially reducing the frequency and the severity of infectious diseases. Probiotics are live microorganisms that, when ingested via food or supplements, benefit the health by restoring or maintaining a favorable balance of the intestinal microbiota. One randomized control trial enrolled over 700 healthy volunteers, and it showed a preparation containing probiotics, Lactobacillus plantarum, Lactobacillus rhamnosus, and Bifidobacterium lactis, lactoferrin, and prebiotics, non-digestible fibers that can serve as a food source for the beneficial gut bacteria, reduced the incidence of respiratory disease during the cold season. The probiotic formulation reduced the number, severity, and the duration of upper respiratory infections. Improvements in bowel function were also observed. In another trial, the same probiotic blend, given with colostrum, the antibody-rich first milk produced in late pregnancy, reduced flu incidence compared with vaccination and with no treatment. Another probiotic, Bacillus subtilis, enhanced the immune response, and it reduced the frequency of respiratory infections in elderly study participants. Aging individuals' immune systems respond less effectively to challenges compared to those of younger people. For example, consequences of the flu are more severe in the elderly, with a lower likelihood of complete recovery and a higher risk of transition into chronic illness. An estimated 90% of influenza-associated deaths in the US occur among people aged 65 and older, and most are related to cardiovascular and pulmonary complications. Poor antibody response to vaccinations in the elderly adds to their vulnerability. Diminished immune system function is also evidenced by increased rates of autoimmune disease and cancer in the elderly, and by increased susceptibility to infections. This well-recognized deterioration of immune function, or immune senescence, is a hallmark of aging. Immune senescence also contributes to enhanced vulnerability of older adults to cardiovascular disease, Alzheimer's disease, metabolic syndrome, type 2 diabetes, and osteoporosis. These age-related afflictions share a common denominator: chronic low-grade systemic inflammation, a prevalent feature of aging that contributes to tissue damage and degeneration. Immune senescence is associated with a chronic pro-inflammatory state, which further accelerates immune system decline. Naive T cells originate from precursor cells in the bone marrow and mature in the thymus. These inexperienced T cells have yet to be activated by antigen exposure. Because of their immune inexperience, the naive T cells can be activated to recognize and respond to new challenges. Importantly, a vast supply of naive T cells is needed to initiate a T cell immune response to newly encountered antigens, such as new variations of the influenza virus, new antigens used in vaccinations, and cancer cells. After roughly the age of 70, there's a general decrease in the naive T cells. Furthermore, when compared with naive T cells from younger people, the naive T cells from the older individuals exhibit many functional defects, including impaired ability to multiply and to become mature effector cells. As a result, the ability of the elderly to mount a successful immune response to the new antigens is diminished. This impairs the defense against microbes, reduces vaccine efficacy, and increases cancer risk. Memory T cells are specialized T cells, and they're generated after an initial encounter with an antigen that persists long after the exposure has ended. Upon the re-exposure to the antigen, the memory T cells recognize the antigen, and they launch a rapid and vigorous response. Over time, exposure to multiple antigens increases the body's pool of protective memory T cells. However, memory T cells from older people are often senescent, meaning they've lost their ability to proliferate and they've become dysfunctional. Although unable to divide, senescent cells remain active, secreting high levels of pro-inflammatory molecules such as tumour necrosis factor alpha and interleukin-6. Chronic inflammation triggered by senescent T cells might be a contributing factor in cardiovascular disease and other chronic diseases of aging. There's also evidence that senescent memory T cells can suppress other types of immune cells. Senescence of memory T cells might result in part from lifetime exposure to common viral infections, such as cytomegalovirus and the Epstein-Barr virus. These viruses remain inactive in the body for decades, triggering a chronic low-intensity response from memory cells and other adaptive immune cells. In addition to inducing the chronic inflammation, this long-term low-level T cell activation can eventually contribute to T cell dysfunction and senescence. High natural killer cell activity is associated with longevity and healthy aging, while reduced natural killer cell function is linked to increased illness and death from infections, atherosclerosis, and diminished antibody response to a flu vaccine. Natural killer cell function decreases with age. Activated natural killer cells secrete immune-regulating cytokines, but activated natural killer cells from the elderly individuals generate fewer cytokines than natural killer cells from younger people. The decline in the natural killer cell function that accompanies human aging is associated with an increased incidence of bacterial and fungal infections among the elderly. One of the most dramatic changes that occurs in the aging immune system is atrophy or shrinking of the thymus gland. Thymus atrophy is believed to contribute significantly to immune senescence, and thymus function decreases with age. As the thymus atrophies, its production of naive T cells declines. Along with the accumulation of memory T cells, this contributes to a shift in T cell population towards memory T cell dominance. As a result, the ability to respond to new immunological challenges, including vaccines, is compromised, and susceptibility to infection, autoimmune disease, and cancer increase. The over-the-counter heartburn medication cimetidine can help to combat immune senescence. This drug reduces histamine's ability to stimulate stomach acid production by blocking special histamine receptors in the stomach, known as H2 receptors. It's primarily used to treat indigestion, heartburn, and peptic ulcers. Although researchers have been investigating its other effects for decades, few people realize that cimetidine possesses immune modulating and anti-cancer properties. Clinical trials have been conducted where cimetidine has demonstrated therapeutic benefits as an adjuvant therapy for several types of cancers, particularly colon cancer, stomach cancer, kidney cancer, and melanoma. Cimetidine's benefits are thought to derive in part from its ability to modulate the influence of histamine on the immune function and cancer metabolism. For example, histamine can shift the balance of cytokines and increase the regulatory T cell activity, leading to the inhibition of other immune cells. Studies in cancer patients found that cimetidine prevents treatment-related reductions in the number of T cells, B cells, and natural killer cells, as well as overall anti-tumor immune activity. Cimetidine has further been found to increase the natural killer cell activity and enhance the cell killing capacity of antibody-dependent immunity. Cimetidine has also been found in animals and lab research to enhance the immune response to vaccines against the hepatitis B virus. People with other health problems might also benefit from cimetidine's immune-stimulating effects. In 2 randomized trials, cimetidine prevented immune suppression following heart surgery. Also, early research suggests cimetidine might reverse immune suppression related to a burn injury, and herpes zoster, the virus that causes shingles, with cimetidine treatment leading to a faster recovery. Cimetidine has been found to increase immune responsiveness in mouse models of immune suppression, and to augment the stimulatory effect of interferon, a cytokine that activates immunity on human natural killer cells. Despite their similarities, other H2 blocking drugs, such as Zantac and Pepcid, have not demonstrated the same immune modulating effects as cimetidine, suggesting cimetidine must have a unique property that's not yet been fully characterized. These findings suggest intermittent cimetidine cycles should be considered in an anti-immune senescence regime. Individuals interested in maximizing their defense against immune senescence could take 800 milligrams of cimetidine daily for 60 days, once or twice per year. Cimetidine should only be used intermittently to minimize the possible risks associated with immune overactivity and stimulation, and the increased risk of pneumonia. A healthcare provider should be consulted before starting this. Immune senescence is associated with high levels of the inflammatory cytokine interleukin-6, while low levels of interleukin-6 are common in healthy centenarians. In the elderly, elevated interleukin-6 is associated with twice the risk of death, as well as an increased risk of dementia and Alzheimer's disease, cancer, and frailty. Viruses that affect humans are generally known for the acute infection that they cause, but many viruses have a quite longer-term presence in the body, compromising the vast human virome, as well as other parts of the microbiome. Humans have co-evolved with viruses for millions of years, and they have a mutually dependent relationship with them. Importantly, these latent viruses can become pathogenic as conditions in the body change. The majority of the human virome is made up of bacteriophages, viruses that infect bacteria. However, some viruses that infect human cells persist as latent infections, and they're important members of the human virome. Some examples of these are the herpes virus, the flaviviruses, and retroviruses. It's estimated that every adult carries between 5 to 10 persistent viruses, most of which cause no evident problems in healthy individuals. In fact, long-term carriage of these viruses, especially herpes virus, may contribute to immune regulation by producing molecules that inhibit inflammation and mediating the active T-cell population and enhancing the production of interferon, an important mediator of an antiviral response. A decline in health status due to aging, disease, immunosuppressive therapies, stress, or lifestyle factors can disturb the balance between latent viruses and the immune system, potentially leading to viral reactivation and acute illness. In addition, prolonged activation of T cells by latent infectious viruses appears to induce the gradual exhaustion of these cells and contributes to progressive immune dysfunction. Chronic cytomegalovirus infection has drawn particular attention for its possible role as a contributor to immune senescence. Most carriers are exposed to cytomegalovirus early in life, such that 50 to 90% of elderly adults are chronic carriers. The immune response to cytomegalovirus results in progressive expansion of the memory T cells relative to naive T cells, a pattern that's characteristic of senescence. In addition, T cells targeting the cytomegalovirus have been found to produce more inflammatory cytokines, and they have less capacity to proliferate when activated. Furthermore, conditions related to aging and immune senescence, including cardiovascular disease, Alzheimer's disease, and frailty, have been correlated with persistent cytomegalovirus infection in elderly adults. Other chronic viral infections can also induce immune dysregulation. T cells from individuals with chronic hepatitis C virus show signs of senescence, as well as DNA damage that might interfere with their appropriate activation. Chronic HIV infection has been noted to cause T cell abnormalities similar to those seen with aging, including abnormal numbers and activity of regulatory T cells, lower naive to memory T cell ratio, and suppressed vaccine responsiveness. Recent research suggests antiviral therapies might help to repair the damaging effects of chronic viral infections on the immune system. Signs of HIV and hepatitis C-related immune senescence appear to be partially mitigated by treatment with conventional antiretroviral medications. So far, the effective treatments against chronic latent herpes virus infections have not yet been discovered. The effects of the interaction between novel infectious viruses and the existing virome is a topic of emerging research. One possibility being explored is that illness caused by new viruses, such as SARS-CoV-2, might be more severe due to chronic viral infection, induced immune senescence or reactivation of latent herpes simplex virus, or the cytomegalovirus. A variety of lab tests can be used to assess the immune function. Some common tests are listed. There's numerous other tests available that also assess various aspects of the immune system function, and a physician who suspects a specific immune-related problem can order tests not included in this list. In order to best evaluate the general immune system health, the test should be performed while the patient is well and not suffering from an acute illness or recovering from a trauma, as these conditions can impact the results. Some of the tests are the white blood cell count. Abnormal levels might be a sign of infection, blood cancer, or an immune system disorder. Cytomegalovirus IgM indicates a recent cytomegalovirus infection or reactivation. A positive cytomegalovirus IgG indicates exposure to the cytomegalovirus, but a single test does not distinguish between a past or recent infection. Epstein-Barr virus or EBV antibodies to assess persistent Epstein-Barr viral infection, which could contribute to immune senescence. The human herpes virus 6, IgG and IgM to assess the total antibodies. The natural killer cell function to assess the functional, i.e. the cell-killing capacity of the natural killer cells. A natural killer cell surface antigen to determine the levels of the natural killer cells in circulation. And a complement C3 and C4. Low levels of the C3 and C4 have been associated with autoimmune diseases such as systemic lupus. C-reactive protein. This highly sensitive marker of inflammation indicates immune activation, possibly due to conditions like cancer, infection, injury, or autoimmune disease, and it correlates with cardiovascular disease risk. And cortisol and DHEA tests. Cortisol is immunosuppressive, while DHEA stimulates the immune function. An imbalance between these hormones can contribute to immune dysregulation. Cytokines like TNF-alpha and interleukins like interleukin-1 beta, interleukin-6 and interleukin-8 are proteins that are critical mediators of the inflammatory response. And anti-nuclear antibodies, which are elevated in some autoimmune diseases. Immunoglobulin, IgA, IgG, and IgM are elevated in some autoimmune diseases, multiple myeloma, and acute and chronic infections, and these are decreased in immune deficiencies. And T lymphocyte helper and suppressor profile. This could be helpful in assessing immunodeficiency states. For more information about herbs, supplements, and natural treatment plans, check out my website.